Dr. Bochinski is a faculty urologist at the University of Alberta. Following the completion of his residency, Dr. Bochinski subspecialized in the field of neurourology and sexual dysfunction at the University of California in San Francisco.
So, hello, Dr. Bochinski. How are you doing today?
Good, thank you.
Great. Well, first of all, I'd like to thank you very much for agreeing to appear on our MediViews.com webcast today. And the topic of our webcast today is going to be male sexual dysfunction. Now, there's a variety of different disorders that males can suffer with when it comes to their sexual health. And one way to help categorize these different disorders is to actually group them along the natural sexual response cycle. And so, Dr. Bochinski, I guess my first question to you would be, could you explain a little bit about the natural sexual response cycle?
Sure. In general, males go through 4 discrete cycles in a normal sexual response, and the initial process is generally the desire. So you have to have that little spark of desire, and that generally leads to the excitement phase, which is the increase in rigidity of the penis, and ultimately, hopefully, there will be the orgasmic phase, and followed by resolution, sexual resolution. So those are the 4 processes by which the male will go through in the sexual response.
Okay, and so in general, can sexual dysfunction occur at each of these phases?
Absolutely. I mean, we think of them as discrete, but you have to understand there is significant overlap in all of these processes, and anywhere along those four portions of the cycle, you can have abnormalities, which would ultimately result in sexual dysfunction.
Okay. So now I guess going back to sort of the first part of the cycle there, the desire section, what sorts of dysfunctions can males experience?
I mean, the most common dysfunction with desire is generally a low libido. By far, that is the most common. There are other types of desire problems. People can be hypersexual or have an elevation in their desire, or they may actually have a sexual aversion. So those are probably the most common desire issues that a man can have.
Okay. Now, so you mentioned that sort of low sexual drive is probably the most common. Now, is it considered at all normal to have some decrease in sexual desire as we age, or is...
Yeah, I don't think we should consider it a normal process of aging. For sure, as we get older, unfortunately, it's more common for men to suffer from libido issues. But I think you have to be careful in calling that a normal process of aging. So these men do require treatment. I don't think we can just chalk it up to old age.
Okay. And what can be done for someone who's suffering with decreased sexual desire? Are there any treatments?
So it really depends upon what the cause of the low libido is, or low sexual desire. Sometimes it may be a simple thing as serum testosterone may be low. There may be other disease processes involved here. It may be depression that the person's suffering from. So I think we have to really treat the root of the problem here. If you can ascertain that their primary problem is hypogonadism or a low testosterone level, sometimes we can replace their their testosterone, and they will have a response. Their sexual desire will improve, as sometimes may their erections as well. But there isn't one global treatment for low sexual desire.
Okay. So I guess moving on now to probably one of the more common sexual dysfunctions in males, which is erectile dysfunction. First of all, sort of in general, what part of the cycle would the disorder fall under?
So that would fall under the second part of the cycle, the excitement phase, and you're right, that's probably the most common dysfunction that we deal with as urologists.
Okay. And sort of just in general, I mean, obviously everyone has a sense of what erectile dysfunction is, but from a physician's perspective, sort of what's the definition of erectile dysfunction?
Erectile dysfunction is defined as the consistent inability to obtain or maintain an erection which is sufficient enough for sexual intercourse. So it may just be the inability to obtain an erection or keep an erection long enough for satisfactory sexual intercourse.
Okay, and so like you mentioned, the consistent inability to do so. So does that mean that is it sort of normal for a male to maybe occasionally not be able to get an erection without sort of worrying that they're actually suffering with erectile dysfunction?
Right. I mean, I think there will always be certain times in a man's life where they will have intermittent problems getting an erection or keeping an erection, but really what defines erectile dysfunction is there has to be a persistent problem associated with this. So it's not generally dependent upon conditions that may arise. For example, there may be, although you could still classify it as erectile dysfunction in certain situations if men have problems with erections, there has to be a persistent inability to maintain that erection that really defines the problem.
Okay. And I mean, do we have any idea sort of what proportion of the male population is actually dealing with erectile dysfunction?
Yeah, I mean, there's been numerous studies looking at that, and there's been a wide discrepancy as far as percentages, but perhaps one of the best studies looking at that was the Male Massachusetts Aging Study, and it looked at the incidence of erectile dysfunction in men at various stages of their lives. And in general, men over the age of 50, there's probably an incidence of about 30 to 50%, depending upon their age. Okay. So it's very common.
Wow. Now, sort of what are some of the underlying causes that actually lead to ED?
I mean, the way I look at it myself is I break it down into whether it's an organic cause versus a psychogenic cause.
Okay.
And within those, you can further break it down into specific etiologies. For example, if it's an organic cause, is it secondary to vascular problems, or is it an arterial or venous problem? Is it a neurogenic type of erectile dysfunction? Are there hormonal problems? Are there other things such as drugs that are causing it? Numerous medications can cause erectile dysfunction.
Oh.
So those are the organic causes. Within the psychological causes, and again, these are patients that we tend to see, but we're probably not the best to treat them in our from a urologist perspective anyways, but certainly various psychiatric conditions, depression, any psychiatric condition can lead to erectile dysfunction for that matter. So that's how I usually like to break it down.
Okay. Sort of having touched on some of the causes, then is there certain, I guess, segments of the population that would be considered, I mean, high risk besides, I guess, probably obviously the elderly and...
Sure. I mean, we know that there are a number of different risk factors for erectile dysfunction. In fact, if you think about all the different risk factors for cardiac abnormalities, most of them apply to erection problems as well. So anyone with diabetes, hypertension, elevated cholesterol, obesity, the same cardiac risk factors put men at risk for developing erectile dysfunction. And you always should include that in your history when you do encounter somebody with those underlying medical conditions, to inquire about their sexual health. Okay.
Great. And so now I'm sure the question on millions of men's minds is, what are some of the treatment options, and I mean, are they effective in dealing with ED?
Yeah, fortunately nowadays we have a plethora of different medications that are available to us. 20, 25 years ago we had very few things that we could do for men who presented with erectile dysfunction, and that was probably the reason why many men stayed in the closet per se about their problem. But over the last 12, 13 years, with the introduction of things like Viagra, Levitra, Cialis, these are medications, oral preparations that men can take that will help enhance their erections. Aside from the simple things like the pills, there are other things, second line, third line treatments that men can use for erections, including you can use intracavernosal injections, vacuum erection devices, and finally there's other things such as surgery. We can do penile prosthesis insertion for men with erectile dysfunction. But first and foremost, I think the easiest thing nowadays is to try something like Viagra type medication.
Okay. And does Viagra have any sort of serious side effects that people should be worried about?
Well, serious side effects, there is always a potential for men who are on Viagra. The one thing you have to inquire about is whether or not they're taking any nitrates. That's contraindicated in men if you wish to start them on a phosphodiesterase inhibitor or Viagra type medication. But as far as other side effects, the most common ones being headache, upset stomach, blurry vision. Some men will get muscle aches. But for the most part, they're very well tolerated, and very few patients actually have to discontinue the medications because of side effects.
Okay, great. Well, I guess moving on now to the third sort of phase of the sexual response cycle, the orgasm phase or orgasmic phase. What sort of dysfunctions can males actually experience here?
So with orgasm, there's again a wide spectrum of different problems that men can experience. They may not be able to orgasm at all or have anorgasmia. They may have a delay in their orgasm. They may feel like they're orgasming, or however, there may not be any emission of semen coming out, and that's something we call retrograde ejaculation. As well, probably the most common abnormality that men may experience is something called premature ejaculation, or ejaculating too quickly.
Okay. And so in terms of premature ejaculation, I mean, again, is there some sort of like a medical definition for it? I mean, because, you know, there's probably a lot of guys who maybe feel like they ejaculate prematurely, but is there sort of a definition as to who is included in this group and who isn't?
Not really. I mean, if you look at any study on premature ejaculation, that's probably one of the things you'll notice is that there isn't an absolute number or time period that you can use to define somebody as having premature ejaculation. I guess what you can reference is whether or not a person is able to have satisfaction out of their sexual intercourse, or if they're ejaculating too quickly and not able to satisfy themselves or their partners sufficiently enough. That would potentially classify as having premature ejaculation, but there isn't an absolute number that we use for that purpose.
Okay. And is there anything that can actually be done to help deal with that disorder?
Yeah, I mean, the treatment for premature ejaculation really has changed over the years.